It's all right.
Well, you look nice.
Oh, thank you.
Okay, are you ready?
Yep.
All right.
Mm-hmm.
How has the flu season affected the hospital this year?
Flu season affects us every year. This year is a little more significant. It's just a little tougher strains going around and people are getting sicker. So we've had a few more admissions, people being admitted with it than we normally do. So, but every year we see it in the clinics and in the emergency rooms.
So you've seen a lot of patients?
We've seen an increase over the last couple of years. I don't know if we're over what our usual numbers are yet, but
What are some precautions that people can take to avoid the flu?
number one way to prevent the flu is going to be your flu shots, and that's very important to get every year. Each year they try to decide what strains will be out there, and then they develop the shots, and it's a good way to get prevent influenza for yourself. Another way for precautions is to try to stay away from people who are coughing. Hand hygiene is very important. If you are sick, to stay away from people, to use proper respiratory hygiene, to cough into your sleeve or cough into a tissue, and again, hand hygiene is very important. So,
How important is it for people to get the flu shot?
very important. Very important. One, because you're not only protecting yourself, you may be protecting other people. The problem with influenza is you actually are spreading the virus probably about 24 hours before you ever have a symptom. So you're contagious before you know you're sick. So if you have the flu shot and can prevent yourself from getting sick, you can prevent spreading it to other people. And you may give it to someone whose immune system or health isn't where they could fight it off very easily, where perhaps they could even die. So it's a way to protect other people also. Protect yourself and other people.
When should people get the flu shot? When's the best time?
CDC now says whenever it's available to start getting it. They believe that the flu shot is effective for about a year. So as soon as it starts coming out, you should probably get it. If your immune system isn't as wonderful as it should be, you may want to wait till, say, November to get it. So.
Are there any risks to getting the flu shot? Is there any reason people shouldn't get it?
Well, if you're allergic to eggs, where you can't eat eggs, you carry around an EpiPen. If you accidentally eat an egg, you can't take the flu shot. So there are a few people who cannot, but not really. There's not too many contraindications.
Is it a myth that when people get the flu shot, they get sick, they get the flu? It is a myth?
It is a myth. It is a myth. Now, it is true that once you get the flu shot, 2 or 3 days later, you may have a low-grade fever, some aching or something like that, but that's your immune system kicking in and building your immunity. So that's really a good response. But it is the flu vaccine, the shot is a dead virus. It is impossible to get influenza from a dead virus. So you get immunity from it, not influenza.
Do you all get flu shots?
Do we give flu shots? We now have mandatory flu shots here at St. Francis Hospital. So all of our employees have to get a flu shot. If they do not for, say, a medical reason or a religious reason, then they do wear a mask when they're around patients.
What are some of the first symptoms of the flu that people should look for?
Usually it's fever and body aches. Some people tell me they feel like they've been hit by a truck or something. They pretty much hurt everywhere. Usually a fever, cough. And it is a respiratory illness. That's very confusing to some people. We talk about, I've had the flu, but a lot of people think the stomach flu with nausea and vomiting, diarrhea type stuff is influenza, but it is not. True influenza is a respiratory illness.
When I got my flu shot, they told me that it would protect against the respiratory, but not the stomach.
Right.
So if I were to contract like the flu, would I get a stomach virus? No, since I took the shot.
Sometimes when you're sick with an illness, your immune system's down, it's not working quite right, then you can, pick up other viruses and get sick. And some people do have some GI symptoms with influenza, true influenza, but Not normally would you get the stomach flu, is that what you're saying when you have influenza?
What should someone do once they get the flu? Like if they see the symptoms coming, what's the first step?
You can do two things. You can go see your doctor and get an antiviral. If you know right up front that you have influenza, then you can treat it. The antivirals will help you shorten the duration and the symptoms of the illness, but you do have to get it fairly quickly. Otherwise, you need to rest, drink your fluids, try to stay away from people, those sorts of things. So.